In terms of skin color or pigmentation versus skin tightening, which one do you want to lean more towards? You will get both. The depth I choose will depend on whether you want resurfacing of the skin more or you want kind of deep collagen remodeling tightening. Because you can't put sunscreen on for the first few days because you're quite raw. So you really want to protect it. The reason why you're doing that is to prevent things like post-inflammatory hyperpigmentation. So it's a pigment that follows trauma. You're going to significantly increase the risk if you go out in the sun. It's going to feel like a really bad sunburn tonight. All right, it'll typically go away in 1 to 2 days. Where it becomes really uncomfortable is the itchy period. So that's about 3 to 5 days. And that's a good sign because it's healing. Anytime you're unsure, please contact us. It's just better we do it that way.
Yes.
We're preparing for a CO2 laser treatment. So as a step in preparing for it, we need to do some really strong numbing cream. So I've got some prescription numbing cream here that we're going to apply. We're going to leave it on for about 30 minutes beforehand. The laser has a little bit of a bite to it, so we're going to make sure the procedure is as comfortable as possible. We're cleaning at the moment because we're making very small pinpoint holes in the skin with this laser in a very controlled way. I need to make sure that there's no bugs on the skin beforehand. So this is just chlorhexidine. It's just a simple antiseptic solution that just cleans the skin down. The things we're trying to do is that she's got some slightly enlarged pores over the nose there. She's got ever so subtle dyschromia. It's just irregular pigmentation. We all have it. It's a little bit of sun damage. She also has slight seborrheic hyperplasia here. You can see little enlarged sebaceous glands there that this will help with to tighten and to reduce the oiliness and just a general overall skin tone and tightening. A chaotic pattern. I don't know if you can see that. Yep. And happy?
When you say it's like mowing the lawn, do you mean it's very obvious where you need to do next?
Very obvious. So it looks like a chessboard pattern. Tell me when you need a break.
Oh, there.
Yeah, and stuff is. I guess trends change. I look, she's so lovely. I've got a lot of time for her. I'm going to do one more. Last one. Actually, one more. I soften borders so you don't have obvious grid marks.
I did see a picture of a woman who had hers done and her face was literally just squares.
So this is insulin. This is topical insulin, so this doesn't get absorbed systemically. So we're using 20 units, 10 units per side, which is really what they suggest. This is going to significantly speed healing. So insulin has insulin-like growth factor. So insulin-like growth factor, which will speed your recovery significantly. So if you get an aggressive treatment with a doctor at Contour Clinics, you should get this. That's typically the standard of care. And
Oh, it looks so fine.
yeah, it'll look worse than this in a few hours' time.
Okay.
We're going to finish off our CO2 treatment today with LED light therapy. It has 3 different wavelengths, this one. So it has red, blue, and infrared. I'm going to use red and infrared now because it's really great for healing. The infrared in particular. Now, LED lights, they've been around for 50 years now, I think. Do you know how they were originally developed? To help plants grow in space.
Really?
Yeah. So they're developed by NASA to help plants grow in space.
Love that.
Love the theories around it.